Hi, this is Taylor Morris, and I'm about to do a bone video for the appendicular skeletal system. To start with is a clavicle. This is a left clavicle. The lateral end is the acromial end, and the medial end is the sternal end. So again, this is a left clavicle. This is a right scapula. This is the scapula spine, right here. This is the medial border, and this is the lateral border, and this is the superior border. You also have the superior angle and the inferior angle. This is the subscapular fossa, and this is the infraspinous fossa, supraspinous fossa, and the glenoid cavity, also known as the glenoid fossa. You also have the coracoid process, just beak-like here, and the acromion process, which is this whole part right here, and the suprascapular notch. Again, this is a right scapula. Next is a humerus. This is a left humerus. Starting on the proximal end, we have the head, the anatomical neck, the surgical neck. We have the greater tubercle and the lesser tubercle. And in between the two is the intertubercular groove. Kind of proximal shaft is deltoid tuberosity. The deltoid attaches here. Going to the distal end on the posterior side is the olecranon fossa, and on the anterior side, still distal end, is the medial epicondyle and the lateral epicondyle. We also have the trochlea and the capitulum. There's also the coracoid fossa and the radial fossa. Again, this is a left humerus. Next, we have a radius. This is the left radius. Starting on the proximal end, you have the head right here, and the neck right below it, and the radial tuberosity. So, on the distal end, you have the styloid process, the pointy part right there. Again, this is a left radius. And this is a ulna. This is a right ulna. Starting on the proximal end, this is the trochlear notch. This is the coronoid process. And this is the olecranon process. This is the radial notch right here. On the distal end is the head and the styloid process. Again, another pointy part. Again, this is a right ulna. This is the pelvic bone. This is a right pelvic bone. We have the posterior inferior iliac spine and the posterior superior iliac spine. we have the anterior superior iliac spine and the anterior inferior iliac spine. We have the greater sciatic notch and the lesser sciatic notch and the ischial spine. Here we have the superior ramus and the inferior ramus and the ischial ramus, the iliac fossa and the iliac crest. This is the acetabulum and the obturator foramen. And this is the ischial tuberosity. The pelvic bone is divided into three parts: the ilium, the pubis, and the ischium. And when this part joins with the other pelvic bone, it creates the pubic symphysis. Again, this is the pelvic bone, and this is a right pelvic bone. Next, we have the femur. This is a left femur. Starting on the proximal end, we have the head and the neck all the ways around. We also have the greater trochanter and the lesser trochanter. And we have the intertrochantic line. It's right here. You can kind of see it. And the intertrochantic crest, which is here. On the shaft, we have the linea aspera, which you can see here is kind of sticks out a little bit. And we have the gluteal tuberosity, which is the rough area above that. On the distal end, posterior, we have the intercondyle fossa or notch, this area here. You can also see the medial condyle and the lateral condyle here. On the anterior side, again, you have the medial condyle and the lateral condyle, the medial epicondyle and the lateral epicondyle. This is the ossipatellar surface. So this is the left femur. Next, we have the tibia. This is a left tibia. Starting on the proximal end, this is the medial condyle and the lateral condyle. And this part sticking up is the intracondylar eminence. You see it here too. It's that part right there. On the shaft, you have the anterior crest. And on the distal end, you have the medial malleolus. Right here, medial malleolus. So again, this is the tibia, and this is a left tibia. Next, we have the fibula. Again, this is a fibula. On the proximal end, you have the head and the neck going all the ways around. You have the shaft, and then on the distal end, you have the lateral malleolus, the part that kind of sticks down more. So again, this is the fibula. Next, we have the patella. This is a right patella, which you can tell by placing on a flat surface with the apex, the pointy part, away from you, and the base, the flattish part, towards you. And whichever way it falls is which left or right it is, and it falls to the right. So it's a right patella. Here we have a hand. I'm going to do these just a little bit differently than the other videos, just because they're a little bit more particular and smaller bones. So this is a hand. This is a right hand. Hands are labeled from laterally to medially. We'll look at the carpals first. So here we have the scaphoid and then the lunate. There's a bone kind of tucked around here. That's the triquintral, and then the pisiform. On the distal row, starting medially to laterally, we have the hamate, the capitate, the trapezoid, and the trapezium. The metatarsals, again, labeled laterally to medially. You have 1, 2, 3, 4, and 5. And then you also have the phalanges. So you have your proximal phalange, your middle phalange, and your distal phalange. Now all of these fingers, all 4 that should be here, have all 3 of those, but the thumb only has a proximal and a distal. So again, this is a right hand. We also have a few carpals that are loose. So first we have a scaphoid. You can tell it's a little bit S-shaped. This is a loose scaphoid. This is a loose hamate, a little bit hammer-headed. And this is a loose pisiform. And so it's kind of the shape of a pea and the size of a pea. That's a pisiform. So I will also be doing the foot over here because it's the same way with smaller bones and a little bit more details needed. So here we have a foot. This is a right foot. Foot, or feet, are labeled from medially to laterally, opposite of the hands, making the halix 1, 2, 3, 4, and 5. Starting with the tarsals, we have the talus, the calcaneus, the navicular, the cuboid, and then we have 3 cuneiforms. You have the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. We also have metatarsals. These are the bases of the metatarsals, and these are the heads. Again, that's 1, 2, 3, 4, and 5. And you have phalanges very similar to the hands, with proximal phalanges, middle phalanges, and distal phalanges, except for the halix, which only has a proximal and a distal. So again, this is a right foot. We also have a few loose tarsals, similar to the hands. So here we have a calcaneus, the loose calcaneus. We have a loose tarsal. I'm sorry, talus. This is a tarsal, but it's a loose talus tarsal. And a loose navicular. That's a loose navicular. Alright, there are also a few arches in the foot. So here we have the arches of the foot. So we have an anterior transverse arch, which is the arch that goes here, kind of across the foot. We go across the foot. We have the medial longitudinal arch, which is here. It's kind of that arch running across there. And you have your lateral longitudinal arch, which is on the other side, and that arch there. So those are the 3 arches of the foot, with 2 longitudinal and 1 transverse on a right foot. Alright, that's all I've got. I hope you guys enjoyed my appendicular bone video, and I hope you learned everything.